कश्चित् दुःखभाग् भवेत्। ॐ शान्ति शान्ति।
May this CME program inspire knowledge, collaboration, and dedication to patient safety. It is my pleasure to introduce our secretary, our president, and our vice president of ISA West Bengal State Branch. I am requesting President Ma'am, Dr. Devjani Gupta, to kindly say some words.
Thank you. I'm on the road and I'm out of station, but I wish a great time of learning and enjoyment. And we are really so happy that we could start the first CME in to many more before our East Zone conference. Happy learning, everyone.
Thank you, madam. Thank you. Our vice president, sir, is there, Dr. Sanjay Patwari. Sir, kindly say something.
Yeah, very good evening, everybody. I'm at the moment a bit busy, setting up. So please go ahead. I'm looking after the band. Thank you so very much.
Sir, thank you, sir. Now I will request our honorary secretary, Dr. Devasis Ghosh, sir, to kindly say some words on our new adventure of ISO online classes.
With Devashish's permission, I will sign off because I'm really on the road. You can hear the noise. Banaras is so congested and noisy.
Okay, madam.
Okay, madam. Thank you.
So, hi everyone, and this new committee of ISA West Bengal has started new things. So, as our scientific secretary, Dr. Shubhajit Guha, and co-scientific secretary, my brother, Dr. Harsha Prabhu, has tried a lot to do this thing into the screen. And today's patient has a big heart. In common language, a big-hearted person is always a good person. But the patient, a big heart is not a thing, I think so. Requesting all my junior residents, please be associated a member of IS National. This year, in 2026, 2nd, 3rd, 4th October is our Eastern Zonal Conference to be in there. And before that, we have the boot camp EGT's residents on 23rd and 24th May at CNMC. So please be there, and let us start today's program. Harsha and Shubhajit, and thanks that conduct nicely so far, and it will be go nice, I think.
Thank you, Devasis da. Now I will request our scientific secretary, Dr. Shubhajit Guha sir, to say a few words. Shubhajit da.
So, very good evening, everyone. So, I am Dr. Shubhajit Guha, own scientific secretary of ISA West. Working at Ruby General Hospital, Kolkata as a consultant neuroanesthesiologist. So, it is a pleasure for me to welcome you all first online monthly CME, or you can say case presentation series of this, which is organized by. So our goal is simple, but it is very vital. Breeze between the textbook knowledge and the high pressure environment final exam. And you know that the final exam is not just all about what you know, but clinical reasoning and how you communicate your anesthetic plan is under scrutiny. And this series is designed to be a safe harbor where you can face tough questions and learn from collective expertise of our esteemed faculty and peers. This as a rehearsal for your exam. Engage yourself, ask questions, and take notes. So now I would like to thank Professor Dr. Shoikogi sir, who needs no introduction. So he is currently posted at the Arjikan Medical College, Kolkata. He is a national level speaker. He is a NB examiner, and he has multiple national publications also. And I also welcome, this is for my privilege to welcome our second moderator, very good friend of mine. For today's session is Professor Dr. Rajashri, who is also in the same department of at Arcot Medical College Hospital. So without further delay, let's begin today's case. So may I request our two distinguished moderators to please introduce your presenters. Thank you, sir.
Thank you, Shubhajit. Good evening to all. First of all, thanks to ISA for also special thanks from behalf of get in this conference. Okay, along with me and Rajashri, along with us, our two final year progressive student, Dr. Indradeep Shaha and Dr. Shilpa Nair. So, further not wasting time, we will go to the case scenario. Indradeep, start the case scenario.
Good evening, respected. I hope I'm audible.
Yes.
So we will. Okay, sir. শুনতে পাচ্ছেন এবার?
হ্যাঁ ঠিক আছে।
হ্যাঁ একটু আসুন। হ্যাঁ হ্যাঁ ঠিক আছে। Okay.
So good evening once again, respected faculties. Both me and Shilpa our ISA West Bengal for providing us with this opportunity. So we are beginning the presentation, that is laparoscopic cholecystectomy in a patient with dilated cardiomyopathy. So the patient is a 48-year-old male, resident of Barashat, West Bengal, and a Hindu by religion. Her chief complaints were recurrent episodes of right upper quadrant pain on and off for the past 6 months. The last acute and was managed conservatively. The pain was sudden in onset, colicky meal with nausea and bloating. The pain is relieved on lying down curled up in bed and responded well to medication. To take tablet rotavirin 50 milligrams. The pain occasionally also radiated to the right shoulder tip. Position of skin. She's a known case of dilated cardiomyopathy, incidentally diagnosed 2 years ago while the patient was admitted for total abdominal hysterectomy and salpingo-oophorectomy under general. The THBSO on general anesthesia was uneventful, but however, no documents were shown. She has 2 children, the younger child being born 21 years back, and both were delivered by normal vaginal delivery. However, 1.5 years back, she was admitted for acute failure and was put in the ICU for 7 days, where she received non-invasive ventilation. Apart from this, she is also a known case of hypertension for the past 8 years and a known case of type 2 diabetes mellitus for 6 years. She currently has NYHA class 2 dyspnea. Drug history, the patient takes the following oral medications, and according to her, she is quite regular with them. tablet carvedilol 12.5 milligrams twice daily, ramipril 1.12 milligram once daily, torsemide 5 milligram once daily, spironolactone 25 milligram once daily, atorvastatin 10 milligram once daily, aspirin 75 milligram once daily, and finally metformin 500 milligrams twice daily. In personal history, her bladder and bowel habits are regular. There is no history of addiction